So some of the symptoms that are hard, that you shouldn't ignore are symptoms that aren't as obvious. It's the numbness in the hands, the stumbling, the balance difficulties, the difficulties with fine motor movements that a lot of times get written off as it's just old age. But in reality, it could be that the spinal cord is being pinched. And that's one of the most concerning conditions that we treat, because if left untreated, it can lead to poor sequelae down the road. If you get minor spinal cord injuries, some of these are irreversible. So, those are some of the symptoms that aren't as easily recognized. The pinched nerve with the severe nerve pain, that's an easy one. That hurts. It prevents people from doing their day-to-day activities and engaging in the fun things they like to do. But it's the subtle spinal cord compression that we treat that, if left untreated, can be irreversible. When someone comes in to see me, we sit down, we talk about what the condition is. We go over the MRIs, and I walk them through the MRI. I teach them, this is what's going on in your neck. If it's something that is going to cause irreversible harm as far as a nerve damage or spinal cord damage, then we don't talk too many options. But if we're just dealing with pain or something that can maybe be treated with physical therapy or injections, we go down that road. There's no one-size-fits-all approach. It's what the patient is experiencing. I can't tell how much pain someone's in. They only know that, and they only know how much that's limiting them. But I do know from experience, by looking at imaging and seeing a pinched nerve, and how bad that must hurt. So the first consultation we meet, it's more of a, get to know each other. We'll sit down and, chat a little bit and, go over, everything that's going on. People want to be comfortable with me, and I want to be comfortable with them. And just want to make sure that, everything's compatible. And, we, sit down and have, pretty extensive conversation. And, a lot of times people are ready when they get to that first consultation. They're like, just fix me. Other people want to take a little bit more time. Either way, it's all individualized. Some of the most common fears with surgery, especially spine surgery, is people are afraid that they're not going to get better. They know someone or of someone who has had a bad experience, and they didn't get better, and they're left with chronic pain. Our techniques to try to alleviate this, the anxiety behind this, is we educate. We use the imaging to describe everything that's going on, as well as describe what we're going to do to fix it. Some of the most common procedures, non-surgical, that we'll attempt, we try them all. Chiropractor, injections, physical therapy, acupuncture, massage. There's no one-size-fits-all. Some people swear by their chiropractor. I do not have a problem with that at all. If it works, great, keep using it. Surgical options come into play when everything else fails and we're not making progress. Spine surgery can be a mixed bag. In my practice, I depend on predictability. And where spine surgery becomes gray is there's a lot of spine surgery that can be performed that doesn't have the predictability. And so you'll get people who don't get as good results because the predictability before surgery wasn't there. When I offer surgery, it has to be high predictability that when the patient's done, we're going to look at each other 3 months later and they're going to be better. If there isn't high predictability in my practice, surgery doesn't happen. Because of our minimally invasive techniques that we use and our experience and efficiency, we're now able to do a lot of these surgeries that once required hospital stays in surgery centers where people are going home the same day. I would say at least 85 to 90% of the surgeries that I do now, people go home the same day and they recover at home. They no longer require going to a hospital, relying on hospital staff to take care of them. And this has been a real benefit to patients and their families and their recoveries. So here at Veritas, we try to create a relaxing environment for the patient experience. We're not a large institution where you have an intimidating structure that you're coming into, an intimidating environment. So we try to personalize everything, with a low-key environment. Our staff are well-trained and interact very well personally with people. Leading up to surgery, we have staff that are well-trained in communicating with the patient, worked out from a medical standpoint, making sure that everything's checked out. So once you get to the day of surgery, we don't have any roadblocks or instances where we'd have to postpone. The day of surgery, it's another low-key environment in the surgery center. You come in, check in, and you have your own set of staff that works with you. You have your own nurses. You don't get handed off, and you get basically concierge treatment. So after surgery, it's typical to take a little while to wake up from the anesthesia. You're expected to be groggy for a good 3 to 4 hours afterwards, and the anesthetic will linger in your system for a good 24 hours. So we just ask that you don't operate heavy machinery or do make any decisions of consequence. Typically, when you wake up from spine surgery, if you're having nerve pain, that nerve pain is better as soon as you wake up. You will have some soreness from the procedure itself, and we treat that with medications and help guide through that process. From the postoperative physical therapy standpoint, most patients don't need physical therapy after our outpatient procedures. By the time people are recovered enough where we're comfortable for them to go back to physical therapy, they've reached a point where they don't need it. There are conditions where someone comes in with weakness because the nerves have been pinched a long time or the spinal cord's been pinched, and then we start working on physical therapy up front. And we work directly with a group of physical therapists who understand the needs of what that individual is going to require.